we had 8 beneficiaries in one of these substance use disorder centers, 8 who were already dead, but the center was still billing us. Not only did they let the person pass, they kept billing for it. That's the level of avarice we're talking about. So CMS is done paying and chasing. We don't think jail sentences are the right way out. These criminals flee the country. Many are foreign nationals. Instead, we're launching the largest action against fraud that we've ever taken. The money's not going to ever leave the building again. We're going to start draining the swamp of the crooks that have inhabited it and are defrauding us. There are 3 bold actions. The first, and for many of you maybe the most important, is we're going to, for the first time, take a massive action to defer funds to a state. Let's start with this Medicaid program in Minnesota, which serves pregnant women. Medicaid takes care of our children. 53% of kids are born into poverty. They're supported through Medicaid. Disadvantaged seniors, individual disabilities. It's unponderable that you would take advantage of these precious programs, yet they're putting it at risk, all of it, by stealing the money. So it's our duty to preserve Medicaid, and what we're going to do is identify the scammers, which we have done in Minnesota. We've identified that they've hijacked, in particular, a certain part of the Minnesota Medicaid system. Said differently, and I'll just put the numbers out there, it's going to be $259 million of deferred payments for Medicaid to Minnesota, which we're announcing as I speak to Governor Walz and his team. And that's based on an audit of the last 3 months of 2025. Restated, $250 million is not going to be paid this month to Minnesota for its Medicaid claims. Now that's $250 million of money. That's your money. It's your taxpayer money. And these home and community-based services, which again are services that are typically things you would do for your family, but for whatever reason your family's not there to provide them, are very hard to audit. And for that reason, there's been a lot of slippage. The guardrails have not been well maintained, and if you're not serious about the integrity of the program, you'll see these problems happening in your state, which is why Minnesota's not alone, although they're the first to receive this action. These high-growth areas of fraud are difficult to police, so we require the states to take these issues seriously. This $250 million deferment is hopefully going to get on the radar screen for the state of Minnesota and make sure they are responsive to our requests. We did what any honest and patient-focused agency would do. We have notified the state and that we will give them the money, but we're going to hold it and only release it after they propose and act on a comprehensive corrective action plan to solve the problem. If Minnesota fails to clean up the systems, the state will rack up $1 billion of deferred payments this year. Governor Walz has 60 days, sir, to respond to our letter. And if providers and beneficiaries are worried about getting their money and services, please call your governor. These are services the governor has already paid for. We are just not reimbursing the state. And to make it clear, there is a rainy day fund in Minnesota, so we are very confident that people will not be hurt in Minnesota. This is not a problem with the people of Minnesota, it's a problem with the leadership of Minnesota and other states who do not take Medicaid preservation seriously. Any delay in services is going to be, should be laid at the seat of Governor Walz. I believe he will take this seriously. They're not the only state that's floundering. We have more announcements with other states coming soon. Second big issue has to do with Medicare. So that was Medicaid in Minnesota. It takes care of our most vulnerable populations. Medicare takes care of our seniors. Durable medical equipment. Most of you have not thought much about this category. These are the folks who they serve wheelchairs, canes, they sell knee braces, catheters, Foley catheters. Durable medical equipment suppliers, because they ship prostheses and these items, they're a great target for fraudsters. Here's what they do. They can steal the beneficiary number, and they never ship the product. They pretend to ship the product, but nothing ever gets sent out. So there's no cost of goods sold, there's no inventory, there's no payroll, no one works in the place, it's empty. But they generate millions of dollars of fake bills. There was a national DME fraud scheme that generated $1.1 billion recently in fraudulent orthotic brace orders. The beneficiaries whose numbers were stolen and used, they couldn't get those products. Imagine if you're on an insulin pump and someone steals your number and orders an insulin pump fictitiously, bills Medicare, and then you come and want to get this to deal with your diabetes. You don't get it. That actually happened. And what happens to those patients? They don't know if their blood sugar's so high or so low that they might die. That's